From 4 News Now, with live updates throughout the day, breaking news as it happens, and weather every 10 minutes. This is KXLY Plus.
Good afternoon. For 4 News Now, I'm Rob King. Coming up this Friday, a mobile health tour will be making a stop in Spokane. To give us a little more details as to what it is, why it's important, we're going to be bringing in right now Liz Gardner, the Executive Director of DaVita Giving Foundation. Liz, how are you? Thanks for hopping on.
I'm great. Thank you so much for having us. We appreciate it.
Of course. Liz, why don't you just start by telling a little bit about what is the DaVita Health Tour?
Yeah, so the DaVita Health Tour has been on the road for the last several weeks, going to cities around the country to really provide free health screenings to our community members. So going to community events, it's a 15-minute health screening to really help people manage their health, get the tools and resources they need to live a healthier lifestyle.
Now, why was that something that the foundation wants to do? Why is that important to sort of bring that medical care access to people as opposed to having them go somewhere?
Absolutely. Well, we know that about 1 in 3 people in the United States are actually living with kidney disease right now. And one of the things that we find is that many people, when they're ultimately, perhaps diagnosed with kidney failure, about 50% of those individuals are surprised. They're not prepared for that diagnosis. And so by getting to people earlier, going upstream, by getting simple screenings like your BMI, your glucose testing, managing your blood pressure, we can then give you simple tools, resources, health tips and tricks that allow you to make small lifestyle changes that can help you from, hopefully, prevent you from getting a much, tougher diagnosis like kidney failure to diagnose later on. And again, we know when we go into the community, when we meet people at community events where they are, it's just a lot easier to access, and we know convenience is key.
Now, how important is it to kind of get the knowledge of your current kidney health? Like, how vital is that in sort of long-term prevention?
Absolutely. It's really, really important. Just some of those simple labs that we'll be doing on the mobile health tour. Again, it takes about 15 minutes, a quick lab draw, some measurements, a couple of readings. Those can really help you to know very, very quickly, oh, something's going on. I need to make a change to maybe what I'm eating, or to go talk to my primary care provider to get on a care plan that will help me better manage my health. So it's that education is key for our community members, and that we find so oftentimes, you might be feeling fine. Oftentimes people are feeling fine, so they don't necessarily think to get their labs checked, but getting that baseline information and then following up with your care provider can go such a long way in terms of your long-term health.
Awesome. Now, who are you guys looking for? Is this mainly geared towards adults or children? Does not really matter?
So these are for adults. The screenings will be for adults, so not geared towards children, but really anybody, any adult in the community is welcome. Again, they're completely free of charge. You don't have to be a DaVita patient. You don't have to have ever stepped into a DaVita clinic before. We'll have our teammates on the mobile health bus ready and there to serve our community members. And again, I can't stress it enough. Come on out. It takes about 15 minutes. Super low barrier to entry, and then people can get on with your evening and enjoy the first Friday.
Awesome. Now, some people are considered more at risk for kidney issues. Can you kind of explain that?
Yeah, we know that Hispanic, Black, Indigenous community members are at higher risk for kidney disease. And so for individuals in our community, just again, being proactive in terms of managing their health, getting their labs checked, checking in with their primary care provider, particularly those that are at higher risk, is really critically important. And so for us, that's why being rooted in the community, we have clinics all over the country, but we are community first, company second. And so really being rooted in our communities at events like this, we are just so excited to be back on the road after a couple year hiatus to bring this free resource to members in our neighborhoods.
Now, people that want to participate, do they need to make an appointment, and how much does it cost?
No appointment needed. Just show up that night. You cannot miss it. It is a bright pink health bus. It's wonderful. It's equipped with everything that we need to do the health screening. And like I said, we'll have our teammates on the bus ready there to serve our communities. So you go, you sign up. Sometimes there's a little bit of a wait depending on volume, but you can, kind of sign up and then pop back when they give you your time. But 15 minutes it takes, and totally free of charge. There is zero cost to our community members. So come on out and see us.
Well, that's awesome to hear. Someone might think like, well, I don't think there's anything wrong with my kidneys. Is it still valuable for them to go?
Yeah, absolutely. I mean, again, I think for me, I like to think I'm relatively healthy, young, but getting that baseline information so that kind of even to proactively manage down the road, getting those annual labs, getting your labs checked to have that baseline so that hey, if something looks a little bit different down the road, that you've had that information sort of at your fingertips. So we strongly encourage anybody. Oftentimes, like I said, people with kidney disease feel totally fine. 1 in 3 Americans are living with kidney disease, and perhaps aren't in touch with sort of their body and their health, and they feel fine. And so having that lab data is really, really helpful. To know how to make a treatment plan, or again, make those small adjustments to your diet, your exercise, that can go a long way.
Absolutely. It saves a lot of time, money, and your health down the road, putting that work in now. Liz, is there anything else you want to add?
Just encourage people. Again, I know sometimes maybe it can be a little bit intimidating. To your point, you might be like, I'm feeling totally fine. Why do I need to go? But especially if you're down at First Friday, come see us. Our teammates are I may be a little bit biased, but they're wonderful, and they will take great care of all of our community members. So please come stop by and see us.
Awesome. Well, Liz, thank you so much. Appreciate your time today.
Thank you so much. Thanks for having us, and we'll see you on Friday.
Of course. And like Liz said, they'll be out Spokane First Friday coming up this week. We'll have more details up on our website, kxly.com, in just a moment. If you missed some of this interview, the whole thing will be up on KXLY Plus. Look for it under the Extras tab. Coming up, be sure to stick around. 4 News Now at 5, back in our regular time after Monday Night Football yesterday. But for now, live in studio, I'm Rob King for 4 News Now.